So, Joel, welcome back.
Thank you.
And yeah, notice that again, the speaker is not going to tell you the exact words that you have to follow. So maybe he's going to use synonyms, antonyms. Maybe he is going or she is going to give you some examples, or he's going to define the words that you don't know or the words that are not written. So he said that.
Let me. I think they also mentioned that caffeine could be an issue.
Wait.
I remember thinking it was weird that I had it because at the
Wait.
time I had to visit the doctor a fair amount in 2016 because I was pregnant with my daughter. Even that was fairly straightforward. There were no complications or concerns. Then I suppose a little while before that, I suffered from anemia.
I suffered from anemia. So this is the other synonym of diagnosis. Okay.
I felt really tired and I had dizzy spells.
So tired and what?
Dizzy spell.
Exactly. So notice again, the writer is going to use synonyms, antonyms, examples, and definitions. This is context clues. If you don't know the meaning of context clues, or if I didn't explain them to you, Joel, please check the channel. There is a lesson in the channel which is called context clues. The speaker is going to use context clues all the time. Context clues is really important, not only in listening, but also in reading, because in reading, you need to know the way or the writer is going to write his or her information. Okay? Okay.
There were a bunch of different things that the doctors thought might be contributing to it. I was having heavy periods.
So heavy periods. So the speaker is here. You have to follow the speaker. You don't have to lose him or her. Okay.
And I donated blood as often as they'd let me.
As often as. So as often as she said donated the blood. After that, she said as often as. So notice that the speaker didn't say regularly, literally. She used, as I told you, other words, synonyms. As I told you, maybe antonyms, maybe some examples, or he's going to define this word. So please be careful. This is the way that I have to listen to the speaker and I have to follow him or her, okay?
Okay.
So maybe he's going to mention the date, then he's going to talk about this information. Notice that the date is mentioned at the end. Please be careful, because this is the way that I have to listen. I don't want to lose the speaker at all. Okay. Now, in extract 1, we have current symptoms. Now, in this section about the consultation, the health professional, or maybe the nurse, the doctor, asks how the patient is currently feeling. Patients often describe their symptoms in everyday terms, using idioms and phrases. Please, I have to have enough vocab, enough information, especially in the medical workplace, just to be able to understand the words the patient is speaking. This is extremely important. And so notice that sometimes the patient is going to use terms, idioms, phrases that may be unfamiliar with. So please, you have to be careful about them. You have to practice. You have, as I told you before, I'm sorry, maybe I didn't send the book about OET vocabulary. I'm going to send it. Please try to remind Dr. Aisha Joel just to, for Dr. Aisha to remind me back just to send the file. Not only the OET vocab is really important, the abbreviations, the contractions are really important, because maybe the speaker is going to say a certain contraction. For example, OECD. We have to know the full meaning of OECD. Maybe the speaker is going to say the abbreviation of OECD as OECD. So be careful, because OECD, do you know the meaning of OECD, for example?
I know, بس هلا
It
at
is
this time
about,
I don't remember.
okay. It's about obsessive compulsive
Compulsive disease.
disorder. Exactly.
Disorder.
Exactly. So the abbreviations in the OET, Joel, is really important, because as I told you, maybe the abbreviation is going to be a certain disease, maybe a certain diagnosis or something like, or maybe a certain medicine. So please, you have to be careful and you have to write down all of them. You have to practice them because again, you need them. Okay, now let's discuss or try to practice the present condition. Now, let's try to listen and we have to fill the gaps. Before that, let me give you 10 seconds to read the information about the present condition.
Okay.
Okay, so let's listen to the recording. Please listen carefully. Try to check the keywords. Okay, Joel, before we start, too many students asked me this question. Teacher, all the time, you are telling us you have to circle the keywords. What do you mean by keywords? The most familiar keywords in any international exams. Number one, you have to circle every name. Name of people, name of medicine, name of places. Every common and proper names are going to be keywords. Well, this is number one. Number two, every number is a keyword. Maybe number of the day, maybe credit card, maybe a certain address, maybe about 3 days, for example, 3 months, years. So every number is a keyword. Every number, every place, every venue, and every name is going to be a keyword. You have to circle them immediately because the speaker is going to talk about them, Joel. Okay?
Mm.
And as I told you, by circling the keywords, you will not be able to read. Again, you only have to listen because, as I told you before, we cannot focus on two missions. This is us. This is because we are human beings. We have to focus only on one mission. Now, you can only listen or maybe read by circling the keywords, and absolutely because the speaker is going to talk about them. You have only to take a look at them, not to read them. Okay?
Mm.
Okay. So, paranoid absolutely is a keyword, for example. Okay, flushes, clammy hands is a keyword. Okay, so let's start listening. The recording is recording 3. This is not a real exam. We are just, I'm trying just to give you the chance to get the idea about the recording, Joel, okay?
Yes.
Now track 3, let's listen. Don't lose the speaker, please.
I just don't think that medication is doing me any good. For 3 months, ever since I started taking fluoxetine, I've been feeling really bizarre. I get these terrible headaches that come and go. It's like a shooting pain in my forehead, and I sometimes feel nauseous after eating. And I keep having these hot flushes. My hands will get clammy and I feel anxious and start shaking. I find it difficult to sleep when I'm in bed. I get kind of agitated and I'll start thinking about all of the things that went wrong at work or things that colleagues said to me. Well, perhaps I feel a bit paranoid, I don't know. I just think it's really not worth all these side effects. I suppose I engage in my former OCD behaviour less as a result of the medication, but I think that might just be because I'm spending my time worrying about everything else. It's like I've just swapped my former habits for new ones. I'm compulsive about different things now, like stressing at night. At least before, my OCD was only impacting parts of my day. These drugs, though, they're making my life so much more difficult.
Okay, so this is the recording. Now let me check the way that you wrote the words. How did you solve 16?
It's fluoxetine.
But how can I write that?
FLO
FLO
X A
X A
TINE.
TINE is in, exactly. This is about medicine. Okay, maybe you are not right in writing this word. What about 17? Described as
17 shooting pain.
shooting pain. Amazing. Shooting pain. Shooting double O. This is, and this is pain. Okay. Now, how did you solve 18?
18, it's agitated.
How can I write that?
A,
A,
G,
G,
sorry, double G,
double
I,
G,
T,
I, T,
A, T, E, D.
A, T, E, D. Okay, we are going to check that. Now, what about 19?
19, it's worrying.
It's worrying about different things. Okay, let me write worrying. Now, let me show you the answers or the correct gaps or words. Let me scroll down to the correct words. Okay, this is fluoxetine. So notice that fluoxetine, you missed writing the U letter. And it is not A.
Also A.
Oh, bravo, we
Mm.
have to write E. So this is what I meant by being familiar with the medication or maybe medical vocab. This is really important. Ah, this is fluoxetine. Shooting pain is correct. Thank you so much. But you said 3 is what? Or 18 is anxious. Feeling anxious and paranoid. If you remember again, Joel, when explaining the context clues, I told you that the speaker maybe is going to mention synonyms, antonyms, definitions, and
Be-
examples. Yeah, because maybe he's going to say or and or maybe or. So be careful. This is really important. Okay. So we have a certain word which is wrong. We are going to repeat listening to this recording just to know, to check or to make sure that it is anxious. The final one is what? Compulsive or OCD.
Mm.
Okay, let's repeat listening to the recording because we have to write down the correct words. Let me repeat it.
I just don't think that medication is doing me any good. For 3 months, ever since I started taking fluoxetine, I've been feeling really bizarre. I get these terrible headaches that come and go. It's like a shooting pain in my forehead, and I sometimes feel nauseous after eating. And I keep having these hot flushes. My hands will get clammy and I feel anxious and start shaking. I find it difficult to sleep when I'm in bed. I get kind of agitated and I'll start thinking about all of the things that went wrong at work or...
Did you notice that?
He said anxious even before.
Yeah, he said exactly. Let me try just to go back a little bit because he said it really fast with and.
Yes.
I find
Yeah.
it difficult to sleep when I'm in bed. I get kind of agitated
It's before.
It's before, exactly. So again, let me go back a little bit.
and I feel anxious and...
I feel anxious. So this is it. I feel, feeling. So he said I feel as a verb, but here it is written as a noun. So I feel or feeling anxious. And paranoid. Okay, we still have the last one. Now we have to listen compulsive or OCD.
start shaking. I find it difficult to sleep when I'm in bed. I get kind of agitated and I'll start thinking about all of the things that went wrong at work or things that colleagues said to me. Well, perhaps I feel a bit paranoid, I don't know. I just think it's really not worth all these side effects. I suppose I engage in my former OCD behaviour less as a result of the medication.
Did you notice that?
Mm.
Okay, let me go back a little bit and let's listen. So this is
Worth all these side effects. I suppose I engage in my former OCD behaviour less as a result of the medication.
so the result of the medication. It's about OCD. So you can write OCD or compulsive, but we have to complete listening. Wait.
But I think that might just be because I'm spending my time worrying about everything else. It's like I've just swapped my former habits for new ones. I'm compulsive about different things now, like stress.
So I'm now what?
Compulsive.
About what? Different things.
Different
So,
one.
bravo, I'm compulsive about different things. Let me close this window and let me repeat the recording just little again.
New ones. I'm compulsive about different things now.
So, I'm compulsive about different things now. So, compulsive, or you can write OCD, which is the abbreviation of obsessive compulsive disorder. So, this is about a prison condition. The things this speaker is feeling right now. Okay. Now, 4 is about the treatment. Now, this section of the consultation discusses the patient's current or maybe future treatment. The patient may describe how they, or maybe the patient, the people who are sick, how they have been finding their treatment, or they may simply describe the treatment that they have been following till now or so far. So let's try to practice that. We have this exercise which is talking about the treatment. This is it. Now, as usual, I'm going to give you, wait, 10 seconds just to try to read the information. Don't forget to circle the keywords, to underline the keyword, just to be able to follow the speaker.
Okay.
Okay, how fast you are. That's amazing. Now let's listen to the recording and let's fill the blanks. Now we have 2:23. The recording is track 4. Let me play it and let's listen.
Okay, Mark, so can you tell me about what happened when you had your heart attack?
Yeah, sure. It all happened really quickly, but I remember feeling this really weird chest pain, like a tightness in my chest. I told my wife my chest was hurting, and when I mentioned I had pains in my left arm, she called an ambulance immediately.
Oh,
Good
good.
thing she knew.
Yeah.
So I remember the paramedics put me into the ambulance and gave me some aspirin.
Yep.
They took me to the ER, and there they gave me a morphine shot for the pain I was feeling. They also put a mask on me for oxygen to help me breathe, and something under the tongue to help. I think it was to help my heart get more blood. It was called nitroglycerin.
Yeah.
My wife was with me, I remember, and she was really great, really helped me to keep calm, although she told me later that she was freaking out.
Oh.
Then they hooked me up to an electrocardiogram, a ECG machine, to look at my heart rhythms. Evidently, it must have showed some kind of blockage because they took me to the catheter lab straight away. I had to be operated on. They called it an angioplasty because I was having a heart attack. The way they described it to me, it was basically like cleaning out the pipes that pumped blood to my heart muscle. They said that if I'd waited any longer to call an ambulance, the heart muscle would most likely have died from the lack of oxygen.
So, this is it about this recording. Now, let me check the words that you have written. What did you write in the blank 20?
Aspirin.
Aspirin, but how can I write that?
ASP
ASP.
IR
IR, exactly.
IN.
IN, bravo. Aspirin, exactly. Now, morphine administered as pain relief. 21 used under.
Nitroglycerin.
How can I write that?
Nitro NIT
T.
R RO GL
GLY
C
C
ER
ER
INE.
all the time. INE, which is about medicine or maybe in. Yeah, what about 22? Observed using
Heart rhythm.
bravo. Heart rhythm, exactly. Heart.
This is my work.
Yeah.
all this paragraph. This is what I do at the hospital.
Amazing. Yeah. Okay. God bless you. How can I write with him?
R
Mm-hmm.
Y
Bravo.
T H M.
THM with him. Okay. What about 23?
Some some people write it
Mm.
after H another Y.
Another Y.
I don't do this. فهيدي
It,
dilemma.
both of them are correct. Okay.
Okay.
Mm.
I
Okay.
know
What?
sometimes I write it like this, sometimes not.
It
So
is not correct. Don't worry. Both of them are correct.
okay.
Now, what about the final one?
23.
Mm.
It's angioplasty.
How can I write
AN
ANGIO
GIO
angio
plasty.
plasty?
PL
Bravo. PLA.
AST.
Amazing. You are really good. Yes. Okay. Now let me check the answers. Let me scroll down just to show you the answer. So this is aspirin, nitroglycerin, heart rhythms, and angioplasty. That's amazing. That's really good. I think you are a good listener, Joel.
Yes.
Yeah.
In IELTS exam, I did well in listening. I like أصلا this task, so whenever I was practicing, I was having fun.
But you
But
have that.
I still feel it's different than IELTS because I don't know if this is how the test is gonna be.
Yes, but
But
wait.
in IELTS,
Mm.
in IELTS, it's only one word or one number.
No, maybe one word, maybe two words, maybe three.
In IELTS, I didn't never I had to write more than 2 words.
You are lucky enough to do that. In the IELTS
That's
exam.
why
Ah.
I was asking myself before, sometimes we had to write 3, 4 words, 2, 3, 4 words. So in IELTS, I was always writing a number, a date, a name of someone.
Yes, exactly. Have you applied to the academic IELTS exam?
Yes, 2 times.
Academic.
Mm.
You have to write 2 essays. One, you have a diagram. You have to take a look at the diagram and you have to write an essay about this diagram. This is about 20 minutes. The next essay, which is about 40 minutes, you have to write a complete essay about a prompt that is going to be shown on the screen. So you have to write 2 essays in a complete 1 hour. This is not that easy if you are not fast enough in writing. And if you don't know how to write a good essay, I mean, I'm talking about the structure, the formation about the essay, you will lose too much marks.
Yes.
Okay, but by the way, let me tell you something concerning the difference between OET and the IELTS exam. This is the main difference. I mean, in speaking in the IELTS exam, in speaking, you have to speak from 11 to 14 minutes maximum, and it's about everyday or general life. But in the OET exam, you have to speak for a complete 20 minutes. In writing section, only you have to write a letter in the OET exam. But in the IELTS exam, you notice that I have to write 2 essays. This is the difference. Okay? But till now,
Yes.
Joel, let me say that till now, you are really good at listening. I didn't expect, to be honest, just to be that good.
Yes.
Ah,
The thing, I opened, I was seeing my last grades. They were good, but they were the same at both the two tests.
The same in speaking and writing.
Yes, speaking, both of them were 6, and writing, both of them were 6 also. Reading in the first one it was 7, the second it was 6. Listening, the first one it was 8, the second one it was 7.5.
Okay. Well, let me tell you something. I know that knowing to be proficient in English is really important. No one can deny that. but it's not everything. I mean, let me tell you something. I still remember that when I have just graduated, from the university, I applied to the TOEFL exam. I thought, this is what I thought, that I didn't have to prepare anything. Now I'm good at English. This is what I said. I'm fresh graduated. I don't have to prepare anything. I can do it. But I couldn't. I got a low band. The reason why, Joel, because I haven't been familiar with the forms, the strategies, the tips, the structure of the exam. Knowing the English, I know that to be good at English is really important, but it's not everything. In speaking, I mean, Joel, in speaking, not only in the IELTS exam, the OET exam, any international exam, in the speaking module, you have to know the strategies, the tips. You have to know these things just to be able to do good at these exams. Okay, so maybe in the IELTS exam, I'm talking about speaking, maybe you are not familiar with the tips, you are not familiar with the forms, strategies, with the questions that you will be asked in this exam. So this is why you didn't get a good band in speaking or maybe in writing. Even in writing, if you don't know how to write a professional essay, to be honest, you will not make it. Yeah, knowing the vocab is well important, but the structure of the essay is important too. You have to know how to write the introduction, the conclusion, the body paragraph. You have to know that what is step number 1 in writing introduction, what is thesis, what is thesis statement, what is the topic sentence, what is the topic, what is the main idea. You have to know these things. If you don't,
Yes.
absolutely, how could you get a good band in writing?
I
By
know
the
that
way,
now because the first time I applied to IELTS, it was I did it with my friend. When we finished, she asked me, what did I write in the second essay? I told her all my points. What she said, it was, you did better than me, أكيد. She said, I didn't I didn't put good points or whatever in this in the writing.
you mean
and still
punctuation marks?
No, it
Do you mean points? The punctuation marks?
no, I mean no, the ideas I wrote in the essay. She said, no, my ideas were very good. When I said them and I was talking to her, I said in Arabic what I wrote. She said, no, they were very good.
I know,
but still, I didn't
what about the structure, Joel? I know that maybe you have good vocab and maybe you can write an amazing idea or ideas. But what about the structure? The essay, it's not a normal piece of writing. It's not like a paragraph, not like report or article or something like that. We have a structure. If you don't follow the structure, you will destroy the body or the structure of the essay. As I told you, writing good ideas is not enough. Yeah, it's important. I know that no one can deny that. But what about the structure? What about the scheme of the essay? It's really important. It is as important as writing good ideas. Okay, Joel, let me tell you something. What do you think? Let me tell you my suggestion. What do you think to start practicing, discussing the writing module and the listening module about the academic IELTS exam? Or maybe you want to complete in the OET exam. You can decide yourself. If we want to start the academic IELTS exam, we have to start with the 2 skills. We have to start with writing, then we have to start with the speaking. After that, absolutely, we are going to discuss reading module, finally listening. But because you need too much practice concerning writing and speaking, we are going to start with these 2 skills or modules. What do you think?
To be honest, I'm a bit scared, so that's why I'm not sure which one to take.
Do you suggest that we have to complete in the OET exam? Maybe you will find it easier in writing and speaking? What do you think?
I don't know because I don't know how the exams.
We're still in the beginning. We're still
Yes.
in extract A, part A. We still have B, we still have C. Absolutely, B, C, you have to select the correct multiple choice. I think it is up to you. I can help you in both ways. But because you have applied to the IELTS exam twice and you found that there is a kind of fossilization, no progress, the same band in the 2 times, I suggest, till now, because you are good, let's complete this way. You have good vocab about medicine. You can understand the symptoms, something concerning medicine and science. This is something good. This is something not that bad, because this is what you need, to be honest. This is your profession.
Mm.
So, again, I can help you in both ways. If you think,
Okay.
if you suggest that we have to start discussing the academic IELTS exam, I'm totally ready to do so. Absolutely.
Can I think about it?
Okay, take your time, but I
And
can, as I told you, I can give you the most important strategies and tips to be really good at both the skills, writing and speaking.
Okay.
Okay, so
Can I think about it and
absolutely you can.
I tell Dr. Aisha or I tell you later, the second time?
Okay, when you know what you have to do, yes, okay, tell Dr. Aisha. If you suggest that we
Okay.
have to complete practicing in the OET exam until we finish listening or something like that, again, I am ready to help you.
Can I ask you something?
Yes.
If you want to continue in the OET, can is there a way to study every day, not 2 times per week?
Holy God. Why, it's something, I'm going to try the best, not every day, 3 times a week.
Yes, because I feel like this it's gonna
It's
take
not
a lot
enough.
of time.
I know, it's not enough. I know. Joel, are you free on Sundays?
Yes, mainly.
If we want to manage a class on Sunday, do you have a problem?
No.
Amazing. What do you think to meet on Thursdays, Saturdays, and Sundays?
Okay, no problem.
Are you off on
I
Sunday?
don't. Yes. Some. It's every week. It's I have a program. It's not. I can't
It's
tell
not
you every
fixed.
Sunday I'm off.
It's
No.
not fixed.
But the thing is, I work at night, so I can study every day during the day.
And the
So
problem
that's
that
why.
I'm attending a course in the mornings. The course is about Mondays, Tuesdays, and Wednesdays. We can meet daily, Joel, on Thursdays, Fridays, Saturdays, and Sundays. Yeah, I can do that.
From Thursdays to Sunday.
Yeah, from Thursday to Sunday, exactly. 4 classes a week. It's really amazing.
Yes, I prefer, to be honest.
Yeah, so we can meet tomorrow, absolutely. What do you
Yes.
think? Yeah, what do you think to do it at the same time?
No problem.
Yeah,
If you
it's
want,
really,
even very early in the morning, I don't mind because I will be awake since 7 a.m., 7, 8 a.m.
amazing, because you are a nurse. You have to wake up early.
Mm.
Uh,
If you
according
want,
according to me, 12 is really amazing. It's really a good time for me. What about you?
it's fine.
Okay, so let's fix that.
Indeed.
Okay?
Okay. Do you think if I'm gonna continue in the OET, how much تقريبا how many times
Do you
it's
need?
gonna take? Yes.
To be honest, at least we need 13 or 14 hours. At least.
For every task or for all the exam?
No, for all of them, for all the course.
Oh, perfect.
Yeah, we can finish that in 13 hours maximum.
Oh, perfect.
I
Yeah.
hope that, I think this is approximately what we need. I don't think that we need more than this because you are not that bad, Joel. To be honest, I thought that you are not that good at English. So this is why I expected just to take longer time. But till now, I find you really amazing.
Thank you.
Yeah. Yeah, so this is, we don't need too much time, don't worry.
My friend gave me the OET book for nursing. It's old, but she applied for OET a while ago. Maybe I can use it also to practice more.
Yes, yeah, absolutely. The more practice, the better you will be, Joel.
It has everything: listening, reading, writing.
Exactly, the 4 skills. Amazing. Yes, you need all of them.
Okay.
Okay, but let me tell you something, Joel. If you are good at listening, let me tell you this piece of advice. If you are good at OET listening, I can promise you that the OET course is going to be easier. Why? Because the speaking and the writing in the OET exam is easier than the IELTS exam.
Okay.
Okay? Let me check. Let's finish the listening section. And believe me, after finishing the listening section, we can know and consider which one is better for you.
Deal.
So, God bless you, Joel, and let me wish a good day for you. Thank you so much.
Thank you.
Bye, 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 bye.
Bye.